Technology Officer at the U.S. Department of Health and Human Services is, in many ways, the Chief Innovation Officer. We look for people and bring them into our team who have a creative, can-do spirit that most people associate with startup companies. But I'm here to say, after a year on the job, that the passion, creativity, and tenacity that we often associate with entrepreneurs can be found within the federal government. That same fire in the belly can also be found in communities of people living with rare disease and chronic conditions. What I have seen in my work are entrepreneurial patients. And I want to tell you about one that you know well, Erin Moore. Erin Moore is someone who embodies the entrepreneurial spirit. In June, she tweeted out a request for help in finding a hands-free nebulizer for her son, Drew, who's 6 years old and wants to be able to enjoy his screen time while he has his 3 times a day cystic fibrosis treatments. And what ensued was a 3-week prototyping and design session. The community surrounded her, an international community of experts, people like Keith Grimes, a clinician in the UK, Jose Gomez Marquez from MIT, tweeted hand sketches of designs, and then she tweeted back prototypes that they were trying at home. What I loved watching all throughout the process was that people would tweet questions like, so how big is that mouthpiece? And she then was able to tweet back a picture of a quarter and say, this is how big it is. And this is a picture of her older daughter getting into the act. They were all around the kitchen table prototyping and working. And they ended up with a fantastic solution for Drew. And what I think is that Erin's work deserves our recognition, as does the work of all the people who pitched in to help. This is Erin's can-do spirit matched with the know-how of a far-flung network of experts that made all the difference. People like Erin are, to me, the latest example of how the internet gives us access not only to information, but also to each other. And that deceptively simple insight is, I believe, the key to unlocking the potential for innovation in healthcare. You're going to hear me using the word maker, and I wanted to pause for a minute and explain what that is. Makers modify and improve the world around them. They look at a problem and say, I'm going to solve that. But even better, they say, my community is going to solve that. The maker movement is also about a return to craft and knowing how to do things with your hands, but upgraded thanks to tools like 3D printers. Imagine what would happen if MacGyver had access to a makerspace like a tech shop. Imagine what will happen when people who are facing physical challenges are able to prototype their own solutions because low-cost manufacturing and design tools are available to them. I see a parallel between the e-patient movement and the maker movement. I think what happened with the democratization of access to information and data is also happening in the democratization of access to design and manufacturing tools. And here's what's really important about open innovation. The most brilliant move that Erin made was to share her problem, to share her question, and to bring that community in. It yielded better prototypes and a great final product. So we know that to untangle and improve healthcare, we're going to need the ingenuity of everyone. Everyone needs to contribute to this. So this talk is dedicated to Erin and all the makers who are practicing open innovation. I'd like to point out that the same spirit is also part of the history of healthcare and science. This is my grandfather. He was a cancer researcher at the University of Maryland. And during World War II, his lab faced shortages. And to keep his lab going, he had to tinker and MacGyver. And he used sausage casings to replace quartz lenses. And he found some surplus blackout reflectors, and he was able to extract the radium for some of the experiments that he was conducting. What I have found in working in the federal government is that our archives contain amazing images and artifacts from this history of the maker movement all throughout medicine and science. And of course, patients and caregivers have also come up with modifications throughout history, new inventions, ways to take their medications, deal with their pain, or just live within their limitations. What I have found is that we now have the opportunity to upgrade people's skills and to crowdsource those solutions. When I think about how technology is changing the innovation landscape, I actually think about a course that I took in college about the history of the printing press. And you might remember that when Gutenberg printed that first book, it was a heavy, ornate, illuminated manuscript. And he was automated the process, which is brilliant, but he recreated what was really a classic form of a book. It was rare, it was printed in Latin, and it was likely to be only owned by a member of the elite class. What he couldn't foresee, and which happened within about 50 years, was that the model for printing changed so that people were printing pamphlets, which could be folded and distributed, printed cheaply and in mass quantities. And I would say that pamphlets connected people not only to information, but also to each other. My favorite description of pamphlets is that they are documents of controversial times. And what I would like to ask you to think about is, what are the documents of controversial times that we have today? Is it Twitter? Is it blogs? What should people be paying attention to? Documents of controversial times, like pamphlets, can start revolutions. This is Thomas Paine's 1776 pamphlet, Common Sense. And it did help spark the revolution and the overthrow of the British. So as we go forward, just think about what's happening now, and how is the model changing? For generations, we've celebrated these inventors like Gutenberg, the Gutenbergs of healthcare, who indeed have given us amazing inventions and innovations and done it in, frankly, rather a top-down, lone genius, priestly capacity. But what I'm seeing in the landscape is a new opportunity and a new model. We have been waiting for a new environment to emerge, one that we didn't even know was possible, where tools are more evenly distributed and the need knowers like Aaron can connect with a community of problem solvers like Jose at MIT. We can still celebrate that lone genius, but let's also celebrate the mom at the kitchen table. Let's celebrate the blogger who can upload their designs and share them. And let's celebrate the people who ask over and over, how might we do this differently? How might we do this better? So here's what I'm seeing in the landscape. Barriers to entry are being lowered in communications, design capabilities, and manufacturing. Collaboration across time and space is now possible, and crowdfunding is now possible. What will happen when everyone has access to the tools and information they need to solve their own problems and share their ideas with others? Everyone is a change maker. It's in all of us, and it starts with a willingness to learn, to be open, and to say, why not? You are all part of this revolution, and you're part of this history and legacy. Our challenge is that a lot of people, particularly people in power, are stuck in the Gutenberg Bible stage of healthcare innovation. They don't yet see what's possible. They may not even realize there's a revolution going on, and they think they can control the conversation. They think they can control the means of production. And they think that their success depends on that control. They're wrong. You know they're wrong, and I know they're wrong. But no surprise, people in power are resistant to change. Much of my career has been spent leading innovation teams within powerful, conservative organizations. And I've been laughed at, belittled, and even insulted by people who doubt that change is coming to their industry thanks to technology. They look at something as flimsy as a pamphlet or a blog, and they don't believe that a revolution can start from that. They don't believe that a mom working at her kitchen table is doing something worth their attention. Each of you has probably encountered someone who doesn't think that information and data should be free, who doesn't believe that people should have access to the tools of production. And in my experience, this can be even more insidious. People say they believe it, but they don't actually take action to open up their process. They don't understand that you need to hand over the tools to people for them to really understand the power of this. They keep the information and data behind a paywall or within their organization. So they deny the existence of people who want access to their own data, and they deny that there's anything of real value to be learned, for example, from people, for example, participating in clinical trials. What I'm here to say, though, is just because they can't see us doesn't mean we don't exist. And it's their loss if they cut themselves off from a source of insight. Find people who want to work with you. Walk away from people who don't see your value. We live in a time of abundant opportunity to connect with people. Show empathy to those who are not yet ready to embrace the revolution or who are terrified by the changes that they see, but don't let them steal your joy. This movement towards participatory design in healthcare is the inevitable result of connectivity. We don't yet know where the path is going to lead, but we're creating a new approach to health that goes beyond what previous generations have been able to imagine. So I want to share a story about how my team at HHS is shining a light on the path of innovation and inviting people to join us. In 2014, the FDA sponsored their first prize competition, the Food Safety Challenge, which called on innovators from all disciplines to help them with the detection of salmonella in fresh produce. 5 finalists were given $20,000 to develop their prototypes, and they also received expert advice from an FDA mentor who's a customer or future user of the product. And at the showcase for finalists, I walked around and talked to each team, and I noticed a couple of things. The first is that each of the 5 teams decided to attack a different aspect of this problem. What a win for the American people. For the investment of $100,000, the FDA was going to benefit from new innovations in this critical issue. The second thing I noticed is that when I talked to each team and asked them, what was the best part of being part of this challenge? They said that while winning the grand prize purse would be great, it's secondary to the incredible wisdom that they gained from having an FDA mentor. They all said they otherwise are not allowed to talk to people at the FDA. Let me repeat that. In the current regulatory environment, the innovators who can help the FDA with critical issues are not actually allowed to talk with them. So I rushed over and talked to my colleagues at the FDA and asked them, what was the best part of the challenge? And guess what? They said it was the opportunity to work with the designers. And they said it was so important for us to be able to tell them, for example, this device is too big, it's not going to fit in the back of my car. Or you have to make this device more durable. It's going to break as we go from site to site. The designers could talk with the customers. They could talk with the end users. And what I have realized is that my job as the Chief Technology Officer is to create space for innovation. This prize competition and the over 120 prize competitions that my team has helped HHS put on, those are pop-up communities of practice, not unlike what Aaron did. People sharing their ideas and finding other partners who can walk together towards change. That prize competition was like an umbrella that they could huddle under for a short time to exchange ideas. So this is an incredible opportunity for all of us to think about, because we know that this is something that we all need to do in healthcare. We need to create space for innovation and to help people find each other, to recognize each other as possible partners for change. So we need to encourage people to share their problems and to allow them to walk alongside each other towards solutions. Our approach, by the way, asks a lot of our colleagues. We ask them to change wholesale how they do their work and to shift their mindset. And so we don't swoop in from above. We walk alongside them, and we enlist them as partners. What I've come to recognize is that technology is really a Trojan horse for change. We say technology, but we mean innovation. That's why, as Chief Technology Officer, I get to say, let's look at this possibility for open data and interoperability, when in fact what I'm talking about is culture change, because that's really what we need in healthcare. And so while I think about technology as a Trojan horse, I really want the collision between healthcare, government, and technology to look less like a battle and more like alchemy, creating something magical instead of creating waste and broken hearts. And what I'd like you to think about is the parallel between what we're trying to do at HHS and what you all are trying to do in your organizations or within your own pursuit of health. How might we recognize the experts way down deep in a hierarchy who know what problems need to be solved? How might we recognize, for example, that there are people who aren't even on the organizational chart who have insights? If you look at the organizational chart for any hospital or rehab center, you won't see patients and caregivers there. And yet they hold so much wisdom about how those businesses could be run better. When I arrived at HHS last year, I brought with me the spirit of the e-patient movement. I'd spent 15 years doing fieldwork in online patient communities, tracking a pattern of people being locked out of libraries, locked out of research labs, locked out of data warehouses. And they used the internet to beg, borrow, and steal access any way they could. They needed those tools to try and save or improve their own lives. The lead users of healthcare showed us the point of technology, showed us the point of the internet as they demanded access to their data. What I also saw in that fieldwork, especially in communities of people living with rare disease like Mobius syndrome, I saw people not only sharing information and data, but they were sharing prototypes and designs of physical objects that they had modified. So Mobius syndrome presents with full facial paralysis, and a baby can't suck on a nipple. And so you need to modify the bottle or modify the sippy cup. And you need to learn that immediately. You need to know that immediately in order to save that baby's life. They also know a lot about how to deal with low dexterity. So as the Chief Technology Officer, I decided to expand my office's definition of technology to include medical and assistive devices. And I've spent the last year looking at this intersection between open innovation and the hardware of healthcare. My work has led me to some incredible people who co-design technology with the people who actually use it, as I saw happening on a recent visit to Pittsburgh at the Human Engineering Research Laboratories, which is a collaboration between the University of Pittsburgh and the VA. Engineers work with returning veterans who use assistive technology, looking for ways for upgrading that equipment to better serve the men and women who use it. This is a picture of the Strong Arm, which is designed to give more independence to people who are using wheelchairs. The picture I can't show you because it's a prototype and they asked me not to, is a design that's based on feedback they got from one veteran. They asked him, what would you like to improve about your power wheelchair? And he said, I'd really like to be able to take my kids to a splash park or to the pool. If water gets splashed on my power chair, then it shorts out. And so the engineers set to work and they created a wheelchair that it runs completely on compressed air, a hydraulic system. Imagine what that'll do for families who use power chairs. They'll now be able to take their kids to the splash park. In my travels this year, I also visited the first makerspace in an American hospital that empowers nurses with tools to create prototypes for solutions to clinical challenges. This is at University of Texas Medical Branch down in Galveston. And what you're seeing here is Jason Schaefer is a burn unit nurse who created a portable shower unit with 3 adjustable heads. And he created it with the help of engineers in the makerspace. He was inspired by the experience that he had caring for someone with a chemical burn over most of their body. He had to use a handheld nozzle to irrigate the skin for over 6 hours. It was exhausting and inefficient, and he knew there had to be a better way. And so he designed this prototype, which is now going to be in action at UTMB, and he's giving talks about it for burn unit nurses all over the country. These inventors are examples of what Eric von Hippel of MIT has called lead users, people who have the problem and are therefore uniquely suited to solve it. Think about how many people adapt medical and assistive devices and then don't share those improvements because they think that what they're doing is illegal, or at least not welcome by industry. Think about how many people would potentially benefit if we could encourage those folks to share their ideas. Smart organizations look for lead users, for people who are solving their own problems, for ideas about new products or improvements to existing products. Where do you see examples of lead users in the hardware sector of healthcare? One group that I'm watching is the We Are Not Waiting group, who are modifying devices to better manage diabetes. I'm also watching the assistive device space for people experiencing age-related disability, because I think that's a growth industry that designers all over the world should be paying attention to. But the barriers I saw in the e-patient and data liberation movement are just as strong or stronger in the medical and assistive technology sphere. The old hierarchical model is one in which the device manufacturers ignore these lead users or even block their access, forbidding modification of devices. Von Hippel characterizes this model as, we innovate, you consume. And the shift to a user innovation model rewards those manufacturers who see the potential and open up to people's suggestions, or even hand them the tools that users need to modify a device. They walk alongside the user. They enlist them as partners, as I saw in Pittsburgh and in Galveston. The forces at work against us are strong, but I believe that we're stronger, and I believe that the tide is shifting in our favor. Here are the currents that I'm seeing in the landscape. Industrial strength manufacturing tools are becoming cheaper, easier to use, and more widely available. Access to new manufacturing capabilities, such as rapid prototyping using 3D printers, creates new opportunities for people to just try something new. New funding mechanisms and opportunities, such as crowdfunding, incubators, and accelerators, enable new entrants to the market. And social media enables people to share their ideas with potential users for design feedback, funding, and distribution. A return to craft and making things with our hands is becoming more of a mainstream activity. And it gives people the skills and creative confidence to demystify devices and solve their own problems. What could happen to boost or mute each one of those forces? What might we learn if we are able to push open design principles out to the edges of the network, where humanity lives, where engineers meet artists? What I'm hoping to do is shine a spotlight on the path forward. We must walk together toward solutions, toward the possibility of sustaining health, toward new or improved assistive devices. We must keep trying and talking with each other and making things with our hands, sharing ideas and data. That's the alchemy of technology. We cannot let people who don't understand us defeat us. This is at the core of being an entrepreneur, and it's at the core of being an e-patient. There are always going to be people who are stuck in the old model because it's comfortable, because it works for them, because they're making too much money to notice that the tide is shifting, and they'll soon run aground. Those people are often in powerful positions, and it seems like we'll never get a fair hearing. So what do? We lead with the work. We don't tell them. We show them our power. We work toward changing open access and open innovation policies at the national level, as the Obama administration has done. We work towards changing the culture at the practice level, as Open Notes has done. We work towards giving people access to the means of production, as the maker movement is doing. We look for people who are not scared of the future, who embrace the possibility that everyone has something to learn and everyone has something to teach. We make things and we share them. We keep shining a light on the path forward, knowing that everyone will join us eventually. Because really, what did people think would happen when we connected a worldwide community of patients, caregivers, engineers, artists, clinicians, and scientists? Just because certain people in power can't see us doesn't mean we don't exist. To close, I want to say I believe in people's innate creativity and can-do spirit. I believe that if we give people tools to solve problems, they will. And I invite you to join me in inventing health. Thank you.